Okay, so let's get started. Dr. Cindy Ross, I'm a cancer specialist and functional medicine expert, and someone who is deeply passionate about helping you take back control of your health. So thanks for joining me tonight, especially last minute. I am streaming live on YouTube. I am recording this as well, so I will pop it up on my other social media channels when I finish. Feel free to ask me any questions that you have. I want to stick to the topic of inflammation tonight, but if you have any ideas for future videos or lives, I'm happy to answer them and address them at that time. So whether you're watching live or catching the replay, you are in the right place. Tonight, I want to share something that I've seen change lives again and again, and the power of lowering inflammation and reclaiming your terrain, especially when you're facing cancer, chronic illness, or you just feel off and unheard. So I wanted to take a minute and tell you the story. Back when, I guess it was February, March, I was facing the probably worst flare of my entire life of living with RA, rheumatoid arthritis, for 27 years. And when I ran all of my markers, all my inflammation markers, literally everything was pointing to being a positive RA factor again. My interleukin 6 was through the roof, and which was higher than most of my cancer patients, and literally felt just debilitated with inflammation. Once I changed my meal plan and really set focus on trying to reduce the inflammation in my body, fast forward 4 or 5 months now, and I've dropped the inflammation, dropped some pounds, and literally just rid my body of anything that was feeding cancer cells, because I felt like I was just absolutely feeding cancer cells. And I did all my blood work last week, and everything came back perfect. I'm not showing positive RA. I'm not showing any elevation in my interleukin 6. And I just want to express, once we control inflammation, I always say it's the root of all evil. We control the inflammation and we can control disease. It is really hard for cancer or chronic illness to live where inflammation is not present, okay? So we have to get the body back to a healthy terrain, to where we're not feeding cancer cells with inflammation. And that goes for even the people that have never had a diagnosis of cancer. We all are fighting cancer every single day. Our bodies are amazing. They're eradicating cancer cells as we speak. It's when things get congested with inflammation that cells need to be addressed. So we just have to remember, we have to keep the inflammation down. So here's the truth. Chronic inflammation is like a slow burning fire inside the body. It damages your tissues, it suppresses your immune system, and it creates the absolute perfect storm for disease, including cancer. But here's the good news. You can change the terrain. So last week, I published my brand new ebook, Reclaim Your Terrain. I guide you through 5 core pillars to start shifting your internal environment and supporting true healing. And you're going to be able to get that book. I did go live last night, and I said it was last night only, but a lot of you had a hard time finding me. So I'm going to offer it again tonight. So you're going to use a promo code at the end, and I'll offer it at the end of this live podcast, because I want you to stay tuned the entire time, of course. But I'll give you a promo code so you can get it for 99 cents. Okay, 99 cents. And so pillar number 1 is going to focus on food as medicine. What you eat is either fueling inflammation or fighting it. So we're going to ditch the processed junk and nourish it with anti-inflammatory powerhouses like berries, greens, turmeric, flax, and crucifix vegetables. Okay? You're going to find all these recipes, smoothie tips, and even my favorite gut healing drink that I did a video on last week. It's going to be all in this ebook. Pillar number 2, movement that heals. This doesn't mean running marathons, gentle walks. That's all I did for the first couple of months. That's all I could do. I barely could walk. Literally, we live on pylons, so I have to navigate stairs. And there were some days that I was so debilitated with inflammation, I couldn't even walk up and down the stairs. We've even contemplated moving from our house because the stairs, it's a true challenge. And if you're riddled with inflammation, you understand what I'm saying. So it doesn't mean that you have to run a marathon. Gentle walks counts. Rebounding. The little trampoline that you did as a kid, rebounding. Light resistance. It all boosts circulation, drains the lymph, and it signals the body to reduce inflammation. I did everything to reduce my inflammation. I literally dove into infrared sauna, red light therapy. I had the compression sleeves on my legs. I was doing cold plunges. I mean, you name it, I was doing it. We have a hot tub. I was using the hot tub. Heating pads, literally everything. Dry brushing. You have to figure out what works for you. I always say there's not a one size fits all. So you have to figure out what works for your body. Pillar number 3, and this is something that every day, I don't take it for granted. Nervous system reset. You cannot heal in fight or flight mode. That's why I share breath work, grounding, and mindfulness tools to help calm the nervous system and lower stress-driven inflammation. If you go to Insight Timer, it's an app, and you can also find it on the desktop. But Insight Timer, I have a few guided meditations on there, but it's a free app. There's thousands of free meditations, guided meditations. I have them from, I think, 3 minutes to 10 minutes. And just get on there and start meditating. Start working on your mindfulness. Every day, wake up. I literally am like this. I wake up in the morning, and I do my hands like this, and I close them, and I am grateful just to be able to have another 24 hours. And then I am even more grateful, especially after going through the worst flare in my life this year, that I can move my fingers and move my hands without pain. And I just am grateful. So you got to figure out what you're grateful for. Just claim it every single morning when you wake up. The first 5 minutes when you open your eyes, that's when you should really just be thankful and have a 5-minute meditation and just reset your body right then, right there, right in your bed, in the comfort of your pajamas, okay? Pillar number 4, targeted support. Supplements like sulforaphane, black cumin seed powder, magnesium, and quercetin can all help support your healing. And the ebook that I wrote, it shows you how to use them safely and effectively. I even put how you should take them, when you should take them, how often. All the details are in there. I just hit my microphone. Pillar number 5, and this is huge. Test, don't guess. And my husband is the worst at this because he will go to the gym and he will come home and he'll say one of his buddies told him that this supplement was great for this and that, and he wants to take all the things. Well, if you're not deficient in it, why would you take it, right? Why would you take it? So you got to figure out what you're deficient in, what you're having an imbalance in, why you're deficient in it. If you're having a gut issue, if you have too much hypochlorhydria, which is the low production of good stomach acid, and you don't have enough enzymes to break it down, those are the things that you have to figure out. You don't want to tax your kidneys and liver by taking a ton of supplements all the time, okay? Supplements can be just as bad as taking a lot of medicine that you don't need. Same with supplements. So I'm going to guide you through in the ebook exact labs that you need to ask for, from your CRP to your vitamin D to functional markers that your doctor might overlook on your general assessment. And if you want to go deeper, the Reclaim Your Terrain ebook is available on my website, okay? So all you have to do is visit lifewellnessforever.com. The link is going to be pinned in the chat and in my bio. So you will not miss your chance of getting it, and the promo code will be at the end of this. Okay, so I know that this hits close to home for so many of you, and so I wanted to dive into some questions that I've already received, and I get these often. So I always say, if you have a question and maybe you're too shy to ask tonight, but if you have the question, I can guarantee you that there are 100 others that have the same question. So we're going to go through these, okay? And if you think of something that you want to ask me later on, if you visit, you can visit my website, but also go to the email hello, HELLO, at lifewellnessforever.com. Shoot me an email. I'm happy to answer anything after this live broadcast as well. All right, so let's start with the questions. Dr. Cindy, what's the biggest sign that I might have inflammation? That's a great question. Some of the most common signs of fatigue, some of the most common signs are fatigue, brain fog, joint pain, skin issues, digestive problems, and even depression. You don't need to have all of them. Just one or two is enough to start investigating. Can inflammation really affect cancer recovery? Absolutely, it can affect cancer recovery, okay? Inflammation feeds cancer cells and tumor growth. Lowering it can reduce reoccurrence risk, improve immune function, and even make treatments more effective. So let me break this down. If you have inflammation, your body is not going to be as sensitive as it needs to be. And that goes if you're taking Eastern or Western medication, okay? So if you're taking chemo and radiation, you still have to work on your inflammation. You have to reduce it. The doctors aren't going to tell you much about this. They are just busy getting you better, and they are attacking that fast-growing dividing cell, okay? I focus on the slow-growing stem cell, because if we don't focus on the slow-growing stem cell, it's going to come back with a vengeance within 1 to 5 years, and it's going to be more resilient, and it's not going to respond to treatment the same. So we have to focus on that slow-growing stem cell, and the way that we're going to do that is by lowering the inflammation in the body to make sure that we're not feeding cancer cells, okay? If you have any questions on that, you just reach out to me. Dr. Cindy, what foods should I absolutely avoid? I just did a video on this the other day on the 3 top things that you can do right now to change your terrain. The top ones are of the foods right now to cut: sugar, refined carbs, seed oils, processed meats, and anything with artificial additives. They are all crazy inflammatory fire foods, okay? So even when you're eating out, you have to be careful, especially when you're eating out. I don't eat out that much because it's tricky and it's challenging, okay? If you go out to eat with me, you understand this. My husband usually pops his phone up to take a video of me really struggling on this. So just assume that they're going to cook in seed oils. So however you want to avoid that, I usually ask for them to, put a piece of chicken on the grill. Don't add anything. No, I don't even like really the spices they use, because you don't really know if they have gluten. You don't know what additives are in them. And then you don't know if they're cooking with seed oils. And then even as salad dressings, I've even lately, especially, I've even just been asking for everything dry, and I've been eating pretty much a raw diet out because it's just safer for me. And I truly think of food as my medicine, especially after going through what I did over the past 6 months. My uncle says to me the other day, he's 80. Hi, Uncle Bob. He says to me, "Do you not ever have a piece of pie?" And I said, I couldn't think of a time that I've had a piece of pie. It's probably been 30 plus years. And I told him, I'm like, "You're 80. Haven't you had a piece of pie for like 80 years? And he's riddled with inflammation. And I'm like, why would you keep having the piece of pie if you know it's going to make you hurt and it's going to cause inflammation in the body? So what that means is you really do have to think of food as medicine. If you're really trying to clean up your diet and you don't want to be feeding cancer cells and you don't want to be feeding inflammation in your body and you're riddled with pain, you have to think of food as medicine and don't divert off of your meal plan. Stay focused on it. Be committed. Stay consistent with it. And I was just having this conversation with my best friend today, and she was like, I pray for the discipline that you and my husband have. And I do. I have crazy amount of discipline, but that's only because I've been riddled with so much pain in my life. So when you get to that point, you're willing to do anything. And if I know that eating this piece of pie is going to affect my health, I'm going to stay away from it. If it's going to kill me, I'm going to stay away from it. And ultimately, it is killing you. So that's the way that you have to think about it. Okay? Dr. Cindy, how quickly can I start seeing results? Many of my patients feel better in as little as 7 to 10 days. They feel more energy, they're clearer thinking, and less bloating or joint pain. Cellular changes can take a little bit longer, but the body responds quickly to consistency. So for me, I would say I was a little stubborn. My body was, again, I was riddled with inflammation. I had this brain fog. But after about 8 weeks of staying consistent, not seeing really any results in 8 weeks, and it does get a little depressing, but you just have to trust the process and stick in there, okay? It's gonna work. Functional medicine doesn't happen overnight. We're not just putting a Band-Aid on it. We are fixing the root cause. But it took about 8 weeks, and then all of a sudden it was like everything was just lifting. I was clear thinking, and then all that inflammation just started coming off my body, and I was able to move better. And then the more that you're able to move, the more you can work out, and the weight comes off, and it's just it's the perfect storm, okay? So just remember, stay consistent. It will happen, okay? If it doesn't happen in the first 7 to 10 days, usually within the first 4 to 8 weeks it will. Dr. Cindy, what if I've already had cancer? If I've already had cancer treatment, can this still help me? Yes, especially after treatment. The body is in such a vulnerable state. These tools support recovery, reduce damage from chemo or radiation, and rebuild your resilience. So after you ring the bell, and I just was listening to a podcast today that says, don't think that you're well after ringing the bell. It's a brilliant statement because it's true. Your body is broken down, and yes, you might be clear of the markers, and there may, you may not have any presence of tumor activity at that moment, but that doesn't mean that your body is not in a vulnerable state. The body has been broken down with the chemo and the radiation, or surgery, or all of it together. And what we have to do is rebuild that terrain so you don't have a reoccurrence and your body's able to fight whatever comes your way. I always say, at one time or another, I preach this all the time, we're gonna have to be on a medication. I mean, it's just, it is what it is. But my job is to get your body back to a healthy state of balance. So no matter what comes your way, your organs, your kidneys, your liver, everything is strong and it can handle the medication. We don't die of cancer. We die because our bodies aren't healthy enough to handle the medication. And then we get complications, and then we're facing our mortality, okay? So we just have to get the body back to a state of balance. I get this question a lot as well, and I was at a cancer conference back in April, and I remember one of the cancer patients was in the audience. She was a testimonial, and she asked, do I have to do this forever? Do I have to do this integrative oncology protocol forever? And one of the panelists said, yes. And it's true. Every day I wake up, and my ritual, it is consuming, but I know the alternative, and it isn't pretty. And if you want a good quality of life, you have to work at this every single day. It's a lifestyle. So yeah, you don't have to be perfect at it. Not at all. Progress over perfection. And my husband always says 10% of something is better than nothing. So I will take that as well. But you have to work on it every single day. Every day I work on keeping my inflammation down. From working out to what I'm putting in my mouth to the infrared sauna to my stress levels. The whole entire day. I mean, throughout my entire work hours, I am working on keeping my inflammation down. So I'm not saying that it has to be a full-time job, even though I am kind of saying it's a full-time job. But be consistent with it, and just know, if you want the good quality of life, it's not about how many years that we're given. It's about how many quality years we have. So if you want quality years, you have to work on consistency with your lifestyle, okay? I don't want you stressing over every bite, but just think about when you do take that bite, is this killing me? Is this slowly killing me? If tonight's message resonated with you, I want you to grab Reclaim Your Terrain ebook. It is your roadmap to lowering inflammation, supporting your body after cancer, and creating an environment where healing is possible. Our bodies are amazing. I have a friend in the hospital right now, and the infection that he's fighting and what our bodies go through and how we're so resilient and we can come back from death's door, it is absolutely amazing. So no matter what state that you're in right now with your health, just know you can turn it around, okay? So just for tonight, I'm going to give you exclusive access to download my new ebook, Reclaim Your Terrain, for 99 cents. I want you to use the promo code INFLAMMATION. That's lowercase INFLAMMATION. Just head over to lifewellnessforever.com, and again, the link will be in the notes, and use the code at checkout. When you download the ebook, here's what you're going to get. My 5-step blueprint for healing your terrain, an anti-inflammatory food list and sample healing plate, my favorite gut-friendly hydration recipe, daily movement and mindfulness practices, supplement guidance to support immune and detox pathways, functional medicine lab suggestions that you can take to your doctor. This is everything that I teach to my patients. I made it simple, clear, and it's ready to implement right now. It's my gift to you tonight because I believe that everyone deserves access to tools that empower healing. And if you want to go deeper on a topic next week, just drop it in the chat or DM me or send me an email, hello@lifewellnessforever.com. I want to keep this conversation going because you are not your diagnosis. You are your terrain. And I'm excited to announce over the next week or so, I am going to announce the VIP members only area on my website. And there's going to be a ton of information. Super low monthly subscriber cost. And you're going to have more information than you know what to do with. Because again, I am all about empowering you with the tools to help make you have the best quality of life possible. So let's reclaim this together. I'm here if you need anything. Have a great night.